Hi, my name is Latoya Nash, and today I will be recording my prenatal precautions video. So basically, what I would do is I would start off with hand hygiene. I would go and knock on the door, go into the patient's room, provide privacy. I would introduce myself, verify their name, date of birth, how many weeks they are, and just inform them on what I would be doing today. So today I will be educating the patient on certain precautions they should take while pregnant. So first I would talk up and educate the patient on certain foods to avoid. And foods that they should avoid should be anything raw, undercooked, or not properly prepared, as foods that are not or undercooked can cause salmonella. Unpasteurized dairy, tell them not to consume unpasteurized dairy because that can cause a bacteria such as listeria and possibly cause miscarriage or stillbirth. I would then proceed to move on and educate the patient on medications that they can take, ones that they should avoid, and supplements that they are okay to take. So first I would inform the patient that acetaminophen would be okay for them to consume. For minor aches and pains, if they're experiencing severe pain, I would inform them to contact their OBGYN and not to consume over 2,000 milligrams per day in 24 hours period. In addition to that, I would also stress for them to avoid ibuprofen, as that can cause circulation problems to the fetus as well as kidney issues. I would also ask the patient if they are consuming any prenatal vitamins and encourage them to take some prenatal vitamins, especially those with folic acid, as that can help prevent neural defects as well as spinal defects in the fetus. And then I would also tell the patient to I would stress a couple of environmental factors for them to avoid, like pesticides, tobacco, lead, as those can cause other issues to the fetus as well as their development. I would stress that, avoiding tobacco because that can cause the baby to have maybe a miscarriage, the patient have a miscarriage or other circulation issues. Then I would also ask the patient if they smoke I would ask the patient if they consume any alcohol or illicit drugs or use tobacco. And I would tell them that alcohol use can create spectrum disorders for their baby, as it could be behavioral, physical, or neural. So I would ask them to avoid alcohol at all costs. I would also tell them to avoid tobacco, as that can cause low birth weight as well as SIDS. And then, of course, I would stress the importance to not use illicit drugs, as those can cause birth defects as well, can possibly prevent circulation to the baby and create stillbirth, as well as the baby can become addicted to whatever the mother is consuming, whatever illicit drug the mother is consuming. I would then also talk to the patient about travel. I would inform her that traveling between her 14 to 28 weeks is generally safe. I would tell her to pack for comfort and also do research surrounding hospitals to where she is going, just in case scenario. I would also encourage her to stay hydrated. I would encourage her to take frequent breaks and to eat frequently and get as much rest as possible. Risk factors could be blood clotting because of prolonged sitting. So that's why I would encourage her to take breaks and if they're driving, take a break from driving, or if they're flying, to just get up and walk around to create circulation in her legs, and also stay hydrated. I would also inform her that dental procedures are typically safe during pregnancy. I would postpone any emergency or elective procedures until after she delivers. I would also avoid x-rays, especially during her first trimester. And then I would also encourage her to continue to brush 2 times per day, brush her teeth 2 times per day, as gingivitis is a common issue with pregnant women.